have worked with Katrina for a number of years now related to lead poisoning prevention and its effects on children and the long-term determinants of health related to lead poisoning. And she's going to talk a little bit about the policies that the city of Rochester put in place for pre-rental inspection to prevent children from getting poisoned to begin with. So on that note, I will turn it over to Katrina.
Thank you. And thanks so much to Cardi for inviting me. I'm very excited to be here. And thank you all for listening. And I especially want to call out my colleagues from Rochester in the who are in the audience, Len Merritt and Ann Wallace, who are back there. And I'm talking about their work, which is always a great accountability thing to have them there. And we may loop them in on the discussion as well. So thank you for setting that up as well. Nancy explained why housing and neighborhoods are important for health, and I'm going to try to very briefly give an example of how. So as we are pursuing sustainable and resilient and equitable neighborhoods, I always like to start by saying that quality and affordability are not enemies, and this is a really good example of what that means and how what that can look like in practice. And there's not a really strong direct connection between the story I'm going to talk about with lead and vacants and zombies and specifically, but there is one concrete connection that I want to call to your attention. Federal law requires that if lead hazards are found in a home, it is disclosed to future renters or owners. If a home is foreclosed on, that chain of communication is broken. So that's one example of how federal policy and these local initiatives to try to promote health sometimes work in opposition to each other. So I was also explained that we are sort of moving from research to policy to practice, and I try to cycle through all of those stages as applied policy scientist. So I'll explain my role in this process going forward. And I'm going to try to give you a really brief overview of Rochester's lead law, focusing on the how more than the what. So about how this one example shows that when we leverage health interests, that can increase community engagement, it can increase political interest and power, and it can leverage additional resources. And how that one example in our community has informed larger efforts to promote health equity in city planning, and has also informed other cities, the state of New York, and federal agencies as well. So again, this is really brief, and I'm unfortunately not going to be here tomorrow because I'm driving to Providence to give a second talk. But I have listed a lot of references about the Rochester lead law at the end, so if you want more details, you can get them. And I did also just write a whole book about it, which is available for free download, so I'll include that at the end, as well as my email. So you have lots of different ways of following up with me. Okay, so why am I telling this story when Len is in the room? So I'm at the University of Rochester, where we've done lead research for a really long time, and we're a major regional health system, so I have a strong interest in promoting health. My department particularly is focused on toxicology, and as an NIEHS center is required to do community engagement. So it's kind of like the role that folks at Cornell Cooperative Extension work with communities across the state, but in this limited area. I started working with the Rochester Coalition to Prevent Lead Poisoning around 2001, and that's been a core focus of my efforts ever since. So helping to do analysis that informed the lead law, being part of the coalition that promoted it, conducting education to support it, and helping to link it with the national network to make sure that it was informed by examples from elsewhere, and then once it passed, an evaluation and dissemination. So I really have sort of a participant observer standpoint on this issue. So taking you back to when I moved to Rochester around 2002, this was a time that around 2% of kids in the US had elevated blood lead levels in our state because we have old housing, more than double that. In our county, more than 3 times. And in the city of Rochester, high-risk areas, nearly a quarter of kids had elevated blood lead levels. And in some neighborhoods, those rates exceeded 30%. In fact, so you can see how those lead rates are concentrated within our county. Again, unit of analysis is really important, within the city, and then within the city in this crescent of poverty that surrounds the central city. The pink and red areas are where lead poisoning rates were over 25% at that time. So one of our local elementary school principals heard this information and about how lead affects kids' ability to learn. And he said, I wonder what the lead rates among the kids in my school were. And he partnered with the county health department and got data to find that 41% of the kids coming into his school had elevated blood lead levels. He said, though, this is ridiculous. If lead makes it hard for kids to learn, and my job is to teach kids, I can't do that if they come to school with lead. We need to do something about that. Now, clearly, there were lots of people already working to address the problem of lead in our community already through the health department. But he really broadened the group of people who were engaged in the issue to include educators, doctors, community groups, public interest lawyers, the city, and the county, all around this goal of eliminating childhood lead poisoning by 2010. And the focus being explicitly on protecting children before they are poisoned. And also very clearly saying we're not going to blame one party, we're not going to try to sue the lead paint industry, we're not going to blame landlords, we're going to acknowledge that our whole society allowed this problem to develop and we all have a role in the solution. And also saying this is something that's fixable. Other communities have dealt with this. We need to find a way that's going to work for Rochester, but it's something that is doable, but we really need to change systems. We can't just throw money at this problem. It's not a simple education question. We really need to change systems. But how? So the coalition organized around 3 different tracks. The first was community engagement, the second to develop science-based solutions, and the third is to promote systems change. All around this idea that lead is a health problem with a housing solution. So again, a microcosm of all of these connections between our built environment and human health. So for community engagement, the coalition worked with some direct outreach, but really partnering strongly with existing organizations to show them what their stake was in this problem. So getting the United Way to embrace this as a cause, getting educators on board, and reaching out to community leaders rather than to create a whole new organization, build lead into the agendas of existing organizations. And the goal of its overall communications efforts was to make it economically, politically, and morally unacceptable to tolerate lead in our community, which is a really different way of looking at it. Before then, it had been treated as a health problem that was the business of doctors and health departments, and to ask the question about housing would bankrupt the city. The city's housing director literally said, don't ask that question, we can't afford to answer it. The school principal in the coalition said, that's not an morally acceptable answer, we will figure out a different way. So we were set to mining the literature, looking to other communities, working with the National Center for Healthy Housing and others to find out the best available approaches to try to address this problem in a cost-effective way that would work for Rochester, a place where mean housing values at the time were around $55,000 for a single-family house. So we did that kind of analysis to inform our efforts. We had a science committee that could pull together the data, tapped national experts. We did not do a lot of local data collection. We had a small project called Get the Lead Out, where we assessed about 100 homes and found lead hazards in 95% of them, just validating that this indeed was our problem, and calculating the costs of lead poisoning to our community on an annual basis in terms of education, criminal justice, and other short-term factors. So taking those two things together, by 2004, we were ready to bring the community together and present the solutions and try to get people behind them. I actually have to say, I thought the idea of a community-led summit was sort of a silly one, like who's going to show up for our day-long event on lead, never mind a 2-hour telethon on our public television station. I was totally wrong. So we thought we might get 100 people, 500 people showed up. The phones were ringing off the hook for the call-in show. We had national experts sort of laying out the issues, but the most important thing was that there were commitments from local leaders in all sectors about what they were going to do to make the community lead safe. At the end, one of the most significant ones was that our mayor stood up and said he was going to pass a comprehensive lead bill before he left office in 18 months, and the county executive stood up and said that she would do the same thing. Whatever the city enacted, the county would duplicate. And I think it's no surprise to you that the two of them did not share a podium very often. So then we launched into systems change, passing the Rochester Lead Law, and I'll give you a few more details about that in a minute. But I want to highlight that is not the only thing that happened. The county also, true to their promise, added lead to their inspections of public assistant clients' housing. They also pledged to contribute money to making this system work. The coalition committed to help educating landlords and tenants to make this work. The city pledged to seek lead hazard reduction grants to help fund this work, and we've received over $30 million in HUD grants since then. And it included plans to evaluate the impacts. And this is the part I'm most proud of because I'm a policy wonk. We agreed that we would track emergency housing requests to make sure that the landlord's fears about causing lots of evictions were not founded. Sharing blood lead data between the county and the city to make sure that our efforts were being targeted appropriately, and annually reporting the inspection results so we could track implementation easily in a very transparent way. This was the first time that had been done for any local legislation. So the law itself, just very briefly, added lead inspections to the existing proactive rental inspections that we've had in our city for decades, includes a visual inspection of all rental units and dust wipes in units that pass a visual inspection in designated high-risk areas. That seems counterintuitive to a lot of folks, so I'd like to highlight that. If a unit fails either one of those, then the owner needs to fix that hazard and then pays for a private clearance, which Len tells me is now running about $175. And the city's role is to monitor those private clearance funds to make sure that firms to make sure that they're doing their job. Then reinspection happens every 3 or 6 years, depending on the type of unit. So it affects all pre-1978 rental housing. As I said, it focuses on high-risk areas. It's important to note there are multiple triggers for inspection. There's a regular sequence, but also tenants or doctors or other people in the community can complain and ask for an inspection. And it allows landlords to do the work themselves, keeping the costs down. So I used the 10-year celebration because we have a picture showing that there were a lot of people involved in passing this law. There were still a lot of people involved in implementation. So there's a picture of us 10 years out, at which point 140,000 inspections had been conducted, 95% of which passed. Now remember that number I gave you earlier? 95% of the units failed in our little pilot study before the law was passed. And that says to me that once the city made clear to landlords what had to happen, they did it. So I expected that the passing rate was going to be about 5%. It was 95%. I was one of the happiest moments to be very, very wrong. So our evaluation showed that there were not significant increases in emergency housing. The compliance costs were lower than we had expected. We did some surveys after the law was implemented and found that landlords' support for the program increased after the law was passed, and they've basically made it a part of doing business now. This is the take-home. You don't get this for a lot of health issues, but since the only thing that causes lead poisoning is lead, we can pretty clearly attribute our decline in lead poisoning rates to what's been going on in this community. Now, lead poisoning rates are coming down in all of your communities, but ours have come down 2.5 times faster. It's not just that law. I wanted to reiterate that there were lots of different things that happened along the way. These are just little touch points of things that the coalition did in order to help bring those rates down. And I want to emphasize that this is a collaboration of people crossing boundaries and spanning different kinds of organizations to make this work. And that's a key theme that I want to take away, that this is one narrow law about one specific issue. We can say that it's had a big effect on lead, but it's also had big effects on Rochester beyond lead, because it taught health and housing and non-health stakeholders to work together for the first time. That model has been used for our Rochester Safe and Efficient Homes initiatives. It's been folded into a health impact assessment that I did on our local waterfront revitalization plan, and that idea of integrating health into city planning is thoroughly embraced in our 2034 comprehensive plan. So we looked, and Ithaca, you are the only other place in the state that has health in their comprehensive plan, but we mentioned it over 200 times. So we've got a little healthy competition going there. I also should mention that this initiative has affected lead beyond Rochester. We've lost track, but I think it's over 30 or 40 cities that have contacted either the city or myself or the coalition for help. The picture from the lower left is when 30 people from the city of Cleveland came to visit us almost exactly a year ago, including 3 commissioners, 3 elected councilmen, and their 6 major funders. They passed their lead bill last June. So if you'd like more information about our lead law or the process, here are some websites that are helpful. I think the presentations are shared, so you can always contact me. As I said, there's a list of references. I've spent a lot of time writing about this, and so please read them because that validates all that effort. And then, as I said, I've written this book with, I call it my book-length treatment of the Rochester lead story, as well as a story about Duluth, Minnesota, and Los Angeles, and you can download it for free from that website. So, thank you.
All right, I'd like to thank Katrina for being here.